The brain attack or stroke is a very catastrophic event. The goals of treatment of brain attack are to contain the damage as early as possible, reverse the damage wherever possible, promote the recovery, and last but not the least is to see that it does not occur once again in lifetime. So, the fourth goal is called second stroke is also equally important and one must concentrate. Normal imagination or a feeling or understanding is that once there is a brain stroke, it is the first time and the last time for that individual. It is not true. The brain vessels are aged, affected by the various factors. So, that once there is a disease in the blood vessels, it can repeat again any time. Unfortunately, if it repeats on the opposite side, a person can get totally disabled. To avoid this, we need to identify all the risk factors that are associated with an individual in particular to prevent a secondary stroke. Now, the risk factors are more or less similar to the heart attack. They include the high blood pressure, uncontrolled diabetes, obesity, sedentary life and irregular sleep, snoring, sleep apnea, dyslipidemia, high cholesterols, and there are certain biochemical markers like cholesterol, triglycerides, homocysteine and inflammatory markers, and these are the ones which can cause damage to the blood vessels. Now, depending upon the type of brain attack, there are certain special investigations we need to do to identify inflammatory diseases, endothelial diseases of the blood vessels, congenital diseases of the blood vessels, autoimmune diseases of the blood vessels, neoplastic diseases of the blood vessels and general neoplastic disease within the body and blood dyscrasia itself, that means any kind of abnormality within the blood vessels and the blood components, and last but not the least is there any genetic predisposition for inducing stroke. Now, is a list of conditions we need to evaluate, particularly if there is a young individual, that is a stroke in young, and if there is a recurrent stroke. So, identifying all these risk factors helps us to contain them and control them significantly, so that the blood vessels integrity and the lumen and the blood flow is protected, so that a secondary stroke in the lifetime can be avoided as much as possible. Now, to promote the recovery, we need the timely medication, intervention as well as the rehabilitation, and to contain the damage. Coming to the stroke center at the golden hour is the most important thing. If a person reaches within the 3 hours, we will be able to stop the ongoing damage and protect the brain. By controlling all the risk factors, you are not only protecting the brain, you will also protect the heart, you will also protect the kidneys, so that you will avoid heart attack as well as damage to the kidneys.